measures to be taken to contain the spread of novel coronavirus. Do's: maintain personal hygiene and practice physical distancing. Practice frequent hand washing with soap and water or use an alcohol-based hand rub. Wash hands even if they are visibly clean. Cover your nose and mouth with handkerchief or tissue while sneezing and coughing. Throw away used tissues into closed bins immediately after use. Maintain a safe distance from people during interactions, especially with those having flu-like symptoms. Measure temperature regularly for respiratory symptoms and see a doctor if feeling unwell. For any fever, flu-like signs, symptoms, please call the state helpline number or the 24/7 helpline number of the Ministry of Health and Family Welfare at. Don'ts: do not shake hands or have a close contact with anyone if you are experiencing cough and fever. Do not touch your eyes, nose or mouth or sneeze or cough into the palms of your hands. It is best to not travel unnecessarily, particularly to any affected region, or participate in large gatherings, including sitting in groups at canteens, visiting gyms, clubs, and crowded places. Do not spread rumors or panic. Home quarantine for contact person. Stay in a well-ventilated single room and maintain 1 meter distance from family members. Stay away from elderly people, pregnant women, children, and people with comorbidities within the household. Person must take rest and drink lots of fluids to maintain adequate hydration. Under no circumstances attend any social or religious gathering, for example, weddings and funerals. Avoid sharing household items like dishes, drinking glasses, cups, eating utensils, towels, bedding, or other items with people at home. Wear a triple layer medical mask at all times. This mask should be changed every 6 to 8 hours and disposed of. Disposable masks are never to be reused and then disposed of either by burning or deep burial. A used mask is as potentially infected as someone with the virus. If symptoms appear, such as cough, fever, or difficulty in breathing, he or she should immediately inform the nearest health center or call. Instructions for family members. Only an assigned family member should be tasked with taking care of the patient, and they should avoid touching their face, nose, or mouth. Visitors should not be allowed. In case the person being quarantined becomes symptomatic, all his close contacts will be home quarantined for 14 days, followed by an additional 14 days or till the report comes back negative from lab testing. Environmental sanitation. Clean and disinfect frequently touched surfaces in the quarantined person's room, for example, bed frames, tables, etc., with sodium hypochlorite solution. Clean and disinfect toilet surfaces daily with regular household bleach solution or phenolic disinfectants. Clean the clothes and other linen used by the person separately using common household detergent and dry. Duration of home quarantine. The home quarantine period is for 14 days from contact with a confirmed case or earlier if a suspect case of whom the index person is a contact turns out negative on laboratory testing. You can click on this link and watch this video to know more remedies and more information.